Great, awesome. Thanks, Jeremy. We're going to go ahead and start with a roll call.
Commissioner Cinco? Commissioner Jantz?
Here.
Commissioner Benton?
Here.
Commissioner O'Rourke?
Here.
Commissioner Williams?
Here.
Commissioner Keast?
Here.
Commissioner Hensley?
Here.
Commissioner Webster?
Here.
Commissioner Brimhall? Commissioner Hupp? Okay. Commissioner Cohen? All right, staff present, Sherry Collins? Commissioner Collinsworth? Not here, okay.
Sherry said here.
Staff present, Sherry Collins?
Here.
Carmen Smith?
Here.
Betty McIntyre?
Here.
Carlos Castillo?
Here.
Emmett Hassan?
Here.
Victoria Vaughn?
Here.
And Kyla Dalton Nava.
Okay, perfect. Thank you so much. We're going to go ahead and formally start the meeting. Since we have met quorum, we're going to go ahead and proceed. First action item on the agenda, or actually number 2, would be the approval of minutes. Do we have any discussion related to the meeting minutes? Since I'm not seeing any, I'm going to go ahead and accept a motion to approve the meeting's minutes.
This is Commissioner Hensley, so moved.
Do we have a second?
Commissioner Cienko, I second that.
Commissioner Cienko, thank you. All in favor, please raise your hand. Any opposition? Seeing none, the motion carries. Thank you so much. Moving on to agenda item number 3, the chair's report. 3 things here. First of all, I'm sure some of you are aware that we are still recognizing that the CDC actually has reduced the requirements for masks and meetings and gatherings. So we have that put on the agenda later this afternoon or this evening to discuss how that will affect our board meetings. Secondly is to inform you of the consideration of where we will be meeting and the location of how we will be proceeding with board meetings. And then the third thing, we will have some discussion related to public comment as we've been considering what that will look like as well. So other than that, I have no special specific things that I want to bring up. It's really been quite quiet as far as my duties as the chair. So we're just really, I want to be able to recognize the board members that are still participating, even though they're remote and being involved. I really do appreciate you and the ACDHH staff who can make this remote opportunity work through this COVID, through the pandemic. I appreciate your work greatly, and we're so thankful that you have all this set up. And thanks to the interpreters and to the captioner as well. Just being able to do our work and do the best that we can through these times. Okay, so I'm gonna turn it over to Sherry Collins for the Executive Director's update.
Good evening, everyone. Nice to see all of you on Zoom. Before I give a report, I would like to add to remind as part of the shares report that my annual evaluation will be due, it tend to be in the beginning of the fiscal year, July. So you'll be getting a survey for some of those who are new. It's really straightforward online, and you can do my annual performance evaluation. And then the personnel committee will get together prior to the August board meeting to discuss the result and provide feedback to me as the director. So just kind of want to remind you to be looking for that, to really encourage all of you to participate. Even for the new board members, try to complete as much as you feel comfortable. And it's just a good tool for us to work together. If there's any concern, it can help me to work with the staff on agency goals and how we can improve services in the community. So just want to let you know to be looking for that. Okay. Okay.
Thank you, Sherry.
Well, now to my report. And I'm just picking a few highlights that I think it's important that I wanted to share with you. And of course, you can ask me any question if I not mention anything. But before I do that, you've already noticed we have 2 additional new staff. You probably have seen their name or correspondence with them through email. That's Kyla, who is my assistant, and to the executive team. And you already saw her earlier. And then Carlo is our new business manager. You can see him say hello. Carlo comes from the state procurement office. He has a very strong background in the procurement, as well as many other skills from his previous job in a private sector. So he brings a lot of additional information and skills and resources to the agency. So really thrilled to have him with us. And Curtis is on the sideline working with Carlos as needed. So he's picking up very well. And so it is both of their first board meeting, and I think they're doing a wonderful job. So welcome. Okay. Now let's move on to just a few things. And now we're into our second year in the pandemic, and I'm glad to see things are getting better with the vaccine, the communication for our community. We had 2 big special community events that we partner with Ability 360 and the Phoenix Association of the Deaf. And both of those special vaccine events were very successful. And the communication cards, well, now that the state pod or the vaccine site are shifting to the doctor's office, pharmacy, in a difficult medical environment. So we're very happy to see this shift. Now we have we finally were able to get through the struggles that we've had from the beginning. So things are looking very positive, and that we are at the table addressing any communication asset for our community. So I'm really happy to see that.
Gary?
Yes.
I just wanted to say I was up here in Flagstaff at the state-run vaccine site last Saturday, and on every single table, when you sit down with the person, there was the big long ACDHH, if you are deaf or hard of hearing, right out there on the table. It was, you couldn't miss it. It was awesome to see. So good work.
even more excited that it's happening in Flagstaff, not just in Phoenix, but outside in the rural community. Thank you for sharing that such hard work of the staff. I'm glad to see that, and the public is hearing that. So thank you, wonderful. So that is our evidence right there. So I'm really, I mean, hard work from the executive team, especially with Betty and Carmen, both from the executive team have worked very hard with their contact, because they share their efforts, because there are so many different groups. And I'm just really happy to see the result of their work with the staff's involvement. And that leads me to the virtual. Everything is virtual now. This is the news change and a new shift. And we are finding that providing training virtually is becoming very successful for our community and our partners. Just from February to now, we have provided over 350 training people that we have provided that's related with healthcare, public safety, and employment campaign. All of those three. Just think about how many people we have impacted all over. So people don't have to drive. All they have to do is just get into the computer and join the training. So we're seeing that new trend. So this is wonderful opportunity for our office. Also, some of you, and especially for those who are new, may not realize a few years ago, we received funding to create a new position, hearing healthcare position, and part of our budget request included a hearing aid program for those who can't afford it. It's a very specific target audience. And we've decided that we wanted to do a partnership to set up our office doing the program. We have partnered with the audiology office and ASU, Arizona State University. That project took forever. It's just because of the attorney between the state and the ASU. It's just a lot of back and forth involved, and then COVID came up, really delay a lot of things. Well, I am happy to say that we have finally reached to agreement and begin the program just a week ago. And this agreement that we have will continue till June 2022. We already have people on a waiting list already, because we have been keeping their name since we want to launch the program. So this is I don't want to say it's a good problem, but it's a good indication of the need. So hopefully with this program, we'll have enough data to demonstrate the needs. We need to expand the resources for the most important people who cannot afford hearing aids. So be looking for that information. We still want people to apply so we can add them on the waiting list, not wait until it becomes available. Also, since February to now, and because of the COVID, the deafblind received support services provider SSP. About 207 have received services, even during COVID. So that really shows the need. And I know that number could have been higher if it wasn't for COVID, but that alone showed they still were able to receive the services. Including, you think about the social distance with the deaf-blind individual, you can't be totally separated, but all of the protection was included to make sure the deafblind individual received the service and yet remains safe for both individuals. And I didn't, not going to list all of the media exposure. If you were looking the report, it's a wide range related to the vaccine, about our agency, the employment campaign. So we're really pleased with a lot of different media coverage. So if you're interested in a particular information, contact our office. Betty can send you the specific information. Now that the vaccine things are starting to settle down, hopefully more people will get the vaccine. While that's happening, we are working on the possibility of perhaps there's a conversation right now, what we call ASL Hotline for COVID with 211. We're not sure if that will work, but there is a discussion right now that we might have something accessible for our community that can be directly accessible for those who are deaf, including hard of hearing. Will have a live chat room instead of calling the 211. So we'll keep you posted probably in the August board meeting if we're able to figure out all of the different logistics with the 211, we may be requesting additional funds in our budget request. And that will be shared in the August meeting because our budget request is due September 1st. So just kind of let you know that it's happening right now. So we'll see. Now that we're shifting our effort, getting back to trying to, the new normal is deployment opportunity. Hopefully people go back to work, and that includes our Let Get to Work campaign. We're going to have our Lunch and Learn event on May 25th, which is next week. And I'm not sure exactly how many people registered, but my understanding, my last conversation, there was a lot of people are interested. So maybe Betty will fill that in later. So we're really excited to bring that back and shift our effort on employment opportunity. And also I'm going to let Betty talk about the legislative update when we get to that topic on the agenda. Last, not least, is the financial part. As I mentioned, our budget request is due September 1st. We may be requesting funding for the 211 asset for our community. We recently, all the state agency directors received guidelines from the state HR on working from home, telework. There are several policy and procedures that we have to implement, and it's up to the agency director. And I met with the executive team recently, and beginning of July the 1st, there's a new procedure for all government agencies, whatever they decided to return back to the office, work from home, or hybrid. We've decided to continue with the hybrid approach like we had been the last year for another year, because we're not totally out of the pandemic, and because we don't have the right to ask individuals if they have the vaccine. So in the safety and protection from everyone involved, including the public, I just feel that it's best that we continue with the hybrid approach, but that means that the staff will come in the office when needed, and also they can meet with clients following the CDC guideline. So we'll be slowly allowing the staff on an individual needed basis. So what does that mean for our office? We are required to take telework training for any state agency. So we all have to take that training by the end of June, because this whole new policy goes in effect of July the 1st. With that said, also our lease, we have to pay or assign our lease that we have for another year. So meaning we have to pay in July. So we'll have time 1 year to decide what will it look like next year in 2022. Get back to the office totally, hybrid or hoteling, we don't know yet. So we're going to reevaluate that. We might even reduce our space if we're not going to be back in the office totally. And we will be doing a survey, and that's part of Betty's report related to our 5-year statistic plan. I'll let her talk about that. It kind of relate to that might help us to determine the future of the office if we want to continue with the hybrid approach or hoteling or return to the office. That is the summary of my report, so I'm happy to answer any question.
Thank you so much, Director Collins. Any question from board members or any comments? Seeing none, I would like to say that I appreciate your summary. There have been some big things that you've faced and some big things to come. And I do want to mention that with the hearing aid program, are you accepting hearing aids as a donation? If so, can you explain to us how we can get that information out to the public?
Thank you for that question. There's another thing before I turn it over to Carmen. I wanted to mention about the licensure rule, as you know that we are moving along with that. So I can have Carmen just do a really quick update on that. At the same time, she can answer your question regarding to the hearing aid, can you donate the hearing aid? So Ms. Green.
Good evening, everyone. Commissioner Jantz, for the hearing aid project, the hearing health care program staff, they will, if individuals call us and they have a hearing aid that they'd like to donate, we will be referring them to ASU. And we will have all of that contact information and a process as to how those individuals can get those donations over to ASU. There's some screening that staff are able to do. Some may not be worth sending to ASU based on the screening we do. And for those that are appropriate, we'll have them sent to ASU. Okay.
Thank you.
As for licensure, for those that are get our e-news and that visit our website frequently, you've seen the information about the licensure rules that are under in process right now. So we will be looking at the legal A category licenses and the provisional licenses due to the impacts of COVID. So on, let's see, let me get my dates right. On April 30th, we began the written comment session where individuals have been able to write into the commission and tell us what concerns they may have or suggestions for addressing those particular 2 issues. Additionally, on June 2nd, we will be having an oral comment session that Commissioner Benton will be facilitating for us. And during that oral comment session, it serves the exact same purpose. For those individuals who didn't have an opportunity to write in their comments about those 2 issues related to licensure, they will have an opportunity to join us and provide comments. And shortly after those comments are done, we go back, we address those issues, and we prepare them for the Governor's Regulatory Rule Committee, as well as for our policy liaison in the Governor's office for that review. So you'll be seeing some additional information about that particular process particular to licensure. Any questions? No.
Seeing none. Sherry, any final comments before we move on to the next agenda item?
No, I think that after you listen to Betty's presentation, when she get into the 5-year plan, there might be additional questions. So right now, if no one has a question for us, maybe it's a good time to turn it over for her to give the legislative update and then the 5-year strategic plan.
I completely agree. All right, we will turn the time over to Betty then.
Wonderful. Good evening, everyone. Thank you so much for allowing me to give you a brief update on the legislative action items that are happening. First off, we are still in legislative session. We just ended week 19. We are well over the 100-day mark of the legislative session. Right now, there's not a lot of movement happening at the legislature, and that's because we are waiting for the state budget bills to drop. So this is normal at this time, where they'll maybe have one bill heard on the floor, every day, just to kind of get the members, adjourned in. But we did see a spreadsheet that was leaked for the last week. This budget spreadsheet is the terms that the governor's office and the House and Senate leadership have agreed on. At this point, we don't know if that will be the final budget at this point, because rank and file legislative members have not signed on in support of that, what we're seeing in the spreadsheet. Based off of a cursory review of that spreadsheet, I see no impact, negative or positive, just on ACDHH as an agency, which is a good thing. So we think, we'll be fine as it comes to anything impacting the budget. There are some few key things, if you've been following along with the legislative updates that I send out weekly, is regarding there's going to be a structure change proposed related to the tax structure in Arizona, doing a 3 to 5 year moving to a flat tax rate tax structure versus the progressive tax brackets that we have now. So it looks like that's gonna happen. Now, we won't know officially until the budget drops, so if that will be in what's called the BURBs, the Budget Reconciliation Bill. Additionally, some other things that we think that we've been following as potential impacts on our community related to the unemployment benefits. Arizona is the last, one of the worst states as it relates to unemployment benefits, being the lowest weekly per diem benefit that you can get. So there has been a couple of bills that have been moving through, one from Senate President Fan and then one from Representative Cook. And it looks like President Fan's bill, which would increase the unemployment benefits to $320, will be in the state budget. However, that comes with some conditions for anybody who's on unemployment. So it's not going to be automatically that you get $320. There are some definitely some strings attached to that for someone who's applying for unemployment. So, but that would not take effect until I believe they're saying like fiscal year 2022. So I think in this next coming year, it'll take a year for them to implement. Now, in other news regarding legislative bills, Senate Bill 1092, which you may recall is the commission's bill. This was the one that we This was a redo of last year's bill, Senate Bill 1045. This is the bill that added the definition of deafblind to our statutory duties, codifying the work that we do within the deafblind community, as well as providing the language that the commission shall provide legislative recommendations to the legislature as it relates to language acquisition and assessments for infants, newborns, and children who are deaf, hard of hearing, and deafblind. I'm happy to report that that bill was signed by the governor. It made it through the whole process unanimously, and it's been about 3 weeks that the governor signed it. So 90 days from the close of session, whenever that's going to be, that bill will come into effect. So we're going to start working on the planning for what that bill contains here in the next 90 days in preparation for when it becomes law. And other news, House Bill 2863, that is the bill that you all as a board voted to support, related to the ASDB becoming a local educational agency. That bill finally got through final read yesterday and was passed and is on its way to the governor for his signature as well. So that's really exciting. That had a couple of hurdles, had a couple of amendments to it to clean up some language, but all in all, it's going to do it provides a stopgap so ASDB and the Department of Education can get some solidified processes and language, and it also protects ASDB right now. So, and being the LEA for the students that they serve. So we're really excited that made it through this legislative session. So yay for ASDB on that one. And so those are the two main major things, bills that are going through. Other than that, there is a federal bill, excuse me, that we are monitoring right now. It's called the PRO Act. This is related to interpreters, and this is very similar language that we saw in California's AB 5 having an impact on independent contractors, the initial bill out of California and the federal bill that is being working its way through Congress at this point is around allowing independent contractors like who are Uber drivers, Lyft drivers being classified as employees. But there are some impacts that it may have on the interpreting community, not just American Sign Language interpreters, but interpreters and translators as a whole. So we are just monitoring that bill at this point. It has not, it was moving. It passed out of the House. It's stalling in the Senate at this point. So we don't anticipate it moving anytime soon, but we're going to continue to keep our pulse on that, and making sure that if that bill moves, that it does have an amendment to the ABC test, which is the criteria of what is defined as an independent contractor. And that amendment to the ABC test is what our interpreters will need and have asked for. So we'll definitely keep you in the loop of if that moves or has any change on that. So with that, is there any questions regarding the legislative update that I may answer for any of you?
I see no questions from other board members, but this is Commissioner Jantz. I do have a question. What are your feelings on when the legislative session will be done? And do you think they'll be done by this summer, or do you feel like some of the things that we've been keeping an eye on may not be completed by that point?
Commissioner Jantz, that's a great question. you know, I would have told you 2 weeks ago that they were going to be out next week. And when I saw the budget spreadsheet get leaked, I thought for sure that was going to happen. Unfortunately, we're looking like we're going to be going into June, because they really do need to get the rank and file members on board with the budget. There are a couple of members who have stated publicly opposition to the flat tax plan, feeling it's going to have an impact on local cities and towns, police departments, fire departments, public services. And then we also have other members who are wanting the audit that's happening through the Senate with the Maricopa County election from 2020. So we have members saying that they're not going to vote on a budget until that audit's done. So in the short answer is June. I think they'll be tired by June. So I think they'll want to be out by June. But it really comes down to the Senate at this point, because there's only a 1 vote majority in the Senate between the parties. So if one Republican votes no, then it kills everything. And so there's a lot of power in that, being the 1 no vote. So either the majority party has to give a little bit to the Democrats, who are the minority, in order to get the majority vote, or they hold out until that 1 no vote of their party turns to a yes. So it's the politics of and the fun of this process that we're experiencing at this point.
Absolutely. Thank you so much, Betty. Any final comments or questions from commissioners? I see Commissioner Cienko. Just wanted to get some clarification on the tax information that you were talking about earlier. And I understand that we would have to go through the legislative process for this. And so I assume that it's kind of a no-brainer thing, but I'm sure that the taxpayers will have will not have their say in this, right? They will not have a vote in this. I'm assuming something like this won't be in the next election. Is that correct?
Correct. You as a taxpayer, your voice.
This is Commissioner Keist. I just want to get some clarification on the question that was asked. And this is Commissioner Jantz. Just want to make sure our interpreters are all set. Commissioner Cienko, can you please repeat your question for Commissioner Keist? So what I'm hearing about the different tax rates, it sounds like this is going to be done through the legislative process. And so I'm assuming that the taxpayers will not have a say in this, right? We will not have the option to have this presented to us at the next election. And this is Commissioner Jantz. You got that question, Commissioner Keist? Okay, Betty, can you please answer the question? Thank you.
Yes, I can. The answer to your question is that is correct. This will be a part of the budget. So you will not vote on it. You will not see it as part of what's called a concurrent resolution, which is a bill that the legislature sends to the voters. And it's not an initiative, which is also a voter elected act. So if any voter has concerns or supports that, they should be contacting their legislative members about that. And we do have resources on our webpage, and we include them in our weekly email updates about how you can contact your legislator around any support or opposition to any bill that you may have. It's what we're here to do is help you and others in our community get engaged.
Thank you so much, Betty. Commissioner Williams?
Betty, I was wondering if the legislators have done any kind of analysis to see how the new tax structure would affect the revenues available to the state government.
That's a great question. So the legislature has what's called JLBC, which is the Joint Legislative Budget Committee Review. And that is the team of the tax people and the budget people, and they do revenue projections based off of any change of structure or any appropriation that comes through. So I don't have the exact numbers, but off of the top of my head, but they have the governor's office and the Senate and the House leadership are stating that it's the revenues will not be impacted through this progression, because it's going to be over a 3 to 5 year incremental, progress of moving to the flat rate, flat tax, going from, I think, 2.5 to 4.5%. So now there are concerns about the impacts on cities. That's where there's a lot of debate at this point, is with moving to this new tax structure, the loss of revenue, of shared revenue to the local cities and counties. So, and that's where the projections are coming in, and where you're seeing the difference of perspective on, is there going to really be an impact on the shared revenue piece of this?
Thank you.
You're welcome.
Thank you so much, Betty. Any other questions or comments for Betty on the legislative update? Seeing none. Betty, if you wouldn't mind going on and talking about the 5-year strategic plan, that'd be wonderful.
Definitely. I'm going to actually share my screen to go through a PowerPoint of this process. Make sure you have your interpreters pinned. Can everybody see my PowerPoint? Okay, wonderful. All right, so it is that time of the year, or I should say decade, where ACDHH, other government agencies and entities must do their 5-year strategic plan. So in this brief presentation, I'm going to give a background. I'm going to give the process of the strategic plan, discuss internal, external assessments as part of this plan, and then also provide you as the board timeframes for our agency to accomplish the 5-year strategic plan. So first, the 5-year strategic plan through AZIPS and through the budget it's mandatory. There was a bill that became law years ago called the Arizona Budget Reform, and that Budget Reform Act requires agencies, all state agencies, commissions, boards, to put together a strategic plan every 5 years. As part of the budget reform process, the strategic plan must be results driven. So it cannot be like, oh, we're going to do this. It has to have measurables behind it. And that is outlined in the statute as well. So what it means by results driven is that any strategic plan that is proposed must go through quality management. It must review any budgeting aspect, Sherry mentioned the budget package is due September 1st. This strategic plan is directly correlated to that budget package and must be submitted with the budget package every year. This also is about helping agencies plan for the future. So what resources are the agency, is an agency going to need in the next 3 to 5 years as they're looking to improve their services and accomplish their goals that they've put in their strategic plan. So it really forces an agency or an entity to kind of be forward thinking and what they would like to do for their agency or commission. And then there's a component of performance monitoring and reporting. You, as board members, for the folks who are not as new, you may recall every year we do our AZIPS report, and it's part of your board report. And that's where you're seeing all of our performance measures that are related to the strategic plan. So this is very much where we have to be accountable to our goals. So as part of our strategic planning process, we've done an internal and external assessment. We started this last November with doing our staff retreat on communications. We also did a community survey in January, asking questions and getting feedback and soliciting information from our community partners, our community members, that helped us really hone in and identify who our primary audience is and ways of engaging those audiences. So that's where we started. Now where we're heading is that we are going to be doing some community forums. So it's really important as part of the strategic plan, as Sherry mentioned in her report, about really knowing what the community's wants are and getting the feedback from the community around this, like what the commission does that they really enjoy, where they want us to improve, and actually ask the community what barriers are in the way. That allows the community to understand that just because it's a want, we also have to plan to how do we get through some of the external barriers that we're going to be facing to accomplish something. So we're going to be doing 4 community forums, and I'm going to go over those here in a little bit. We're also going to survey you as the board. We want to know your feedback. We want to know what you would like us to look at and what you would like for us to take on in the next 5 years. So we're really going to be going through this information gathering place over the next month to really pull all this information from everybody. So then we can sit back and say, okay, what can we do? What resources do we need to make this happen? And really do that SWOT analysis, the strengths, weaknesses, opportunities, and threats to accomplishing a strategic plan, especially a 5-year. And then as part of our assessment is also looking at those media trends. We provide you our media communications, which we will evaluate, but also looking at other trends that are going on in media related to issues and challenges that face our community. So not just ACDH media trends, but the media reports on a lot of stuff. There could be stuff there that we should be taking advantage of that will have an impact to our community. So as I said, we're going to be doing 4 community forums in the month of June. We initially were going to do targeted outreach to rural community, we initially were going to do regional forums, but we took a step back and remembered back last year when we did the COVID town hall and what we found our community asked for was that we do each of the forums based off of the deaf community, the hard of hearing community, and the deaf blind community. And it's not because we want to silo each of the communities, but it was around comfort level and accessibility needs for complete engagement of each of those communities, and feeling the need to have a space that was safe, that they can fully engage and provide their comments and feedback. So we are going to do that same approach in June. So we're going to have one forum specifically for the deaf community, one for the hard of hearing, one for the deaf blind. And then we're also going to be reaching out to the Spanish speaking and Latino communities and finding out more of how we can better engage that population. And we're really looking at, in addition to this, accentuating our outreach to our rural communities to engage in this virtual forum. We've made it our mission to make sure that to take advantage of the fact that this is a virtual forum, so we can really get folks who are often not at the table, and doing our part to ensure that we are truly getting the needs of all deaf, hard of hearing, deaf blind members across the state. So we're going to be doing that in June. The board survey, we're going to actually be sending this out to all of you commissioners on Monday, May 24th. It is going to be a Survey Monkey. You will get that in your email. We ask that you take some time to look at it, fill it out. We're going to give you about 2 weeks to complete that, but we really would like your feedback on what you think that we're doing right. And like I said, any activities or initiatives you feel that the commission should be taking on. After we get the feedback from the community forums and from the board, the executive team is going to review all that feedback, and then in addition to any feedback from staff, and then we're going to draft our first strategic plan draft, and then from that we will do a survey back to the community of that strategic plan draft, make sure that we captured what the community is asking for. And then once we finalize once we hear back from that feedback survey, we will then go ahead and finalize the strategic plan. And then we'll send it over to Carlos. So then Carlos can do his part as part of the OSPB and upload it with the budget package. So that is the strategic plan that we are looking at doing in our process. Are there any questions?
This is Commissioner Jantz. Any questions from the board? Okay, I see 2. So we're going to go with Commissioner Benton. And then when she's done, we'll go to Commissioner Keast. Commissioner Benton?
This is a great it's a great plan, and it's nice to see how it's all laid out, Betty, and how it completes the circle by coming back to the community once you have a draft strategic plan. But I wanted to go back to the very, very, very first slide in your PowerPoint, sort of the cover slide, and I don't understand why it says serving deaf and hard of hearing patients.
That's because I have a typo and I stole this PowerPoint from our healthcare PowerPoint.
Okay. Okay. It was a little alarming to see
Yeah,
that.
no, that you just called out my error. That's all.
Okay. That's okay. That's okay. I was waiting for you to say, well, this is focused on the blah 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 that would relate to that. But
No, I just messed up.
Okay. Okay, that's okay. Super. Thank you.
Okay, this is Commissioner Jantz. Thanks, Commissioner Benton. And point of clarification, I'm okay with being a patient if you can accept me. Okay, Commissioner Keast and then Commissioner Cienko. Yeah, I agree with Commissioner Benton. I think this is great that you have this. It's so great to see this big picture. The community forums that you mentioned, you had 4 of them. I'm wondering how you intend to reach people and market this into the communities so that they can actually know about the forums.
That's a great question, Commissioner Keys. We are actually going to be doing a multi-pronged approach. One, we're going to be putting this out on our social media, our e-news. In addition, we're going to be asking our specialists to send it out to their community and their listservs. So then we can really just blast it and ask folks to share it amongst their groups and their communities and their organizations. And we will, of course, we can share it with the commissioners and you guys can share it with your groups as well.
Commissioner Keast, is that good? Did you? Yeah, I have one other thing to add. Go ahead. Oh, that's great, Betty. I do have, maybe if I could add just a little bit of values to that. A vlog, if we could add a vlog to that, if we could add
Yes.
a vlog. Yeah,
Definitely.
like a signed explanation of what these community forums are going to be. Awesome.
Yes, we actually have that in our plan to ask our deaf specialist to do a vlog as part of her distribution to the deaf community.
Awesome. Awesome. Commissioner Cienko. I don't have a question. I just wanted to give a positive comment. The PowerPoint is very clear, very, very clear. I really liked it. The vision that you've created, I'm really impressed with this, and I think that it's going to go in a really great direction. Secondly, Commissioner Benton's comment, I wanted to add to that. I noticed that it said patient, and I was like, oh, okay. And then I was like, nah, you know, but I was trying to figure out what all that meant. But yes, definitely just a typo. I'm happy that we all got a good laugh out of it. We could all use that right about now. But
oh, thank you.
Even with the mistake, it's still so good, Betty. I think you've done a great thing here, and I'm really, really impressed with your work. Thank you so much.
Thank you. Thank you. Thank you. It's just every time I see deaf, hard of hearing, I just automatically assume the third word is deafblind. And so I didn't even give it a second glance because in my mind, it's deaf, hard of hearing and deafblind. So I was not at all looking at patients, but I thank you very much for that feedback. I appreciate that and for those comments.
This is Commissioner Jans. Thank you, Betty, so much. And we appreciate the humor as well. Commissioner Benton, you had another comment?
Yeah, so I was just going to say that now that 1092 is passed, does that mean that we'll be able to officially add deafblind on the front of that or in that verbiage?
Yeah, we definitely add deafblind to all of our communications and messaging. So we'll officially be doing all of that change over here.
Great. Betty, do you have any final comments or does anybody have any final questions for Betty? Not seeing any. Before we move on to the next agenda, I think this is a perfect segue to a break to give the interpreters and our captioner an opportunity to have a quick breather. And then also just to let our eyes kind of relax. So let's do a 15-minute break and let's be back on time at 5:45. Okay, 5:45 we'll be back in 15 minutes.
This is Commissioner Jantz. All right, it's just about 5:45, so if I could get everyone back and we will go ahead and get started again. Still waiting for a couple more commissioners to join us again. And this is Missy. While we're waiting, can we talk about, this is Commissioner Jantz. Actually, we're still live streaming. It is 5:45. We're still waiting on one more person to join us. Susan, okay. Commissioner Webster said her camera was disabled by the host. Jeremy, can you please?
I am
please ask her
here.
to start her video.
1 second.
This is Director Collins. She's here. We can go ahead and get started. All right. Thank you, Jeremy. Are we ready to go ahead and get started again?
Yes, you're still streaming.
Perfect. All right. Thank you, Jeremy. We just had our nice break and we will start our meeting again at 5:47. Commissioner Keast had a follow-up question about Betty's 5-year strategic plan. Commissioner Keast? Thank you so much, PV. During the break, I was thinking about how the word will get out about the strategic plan. I've noticed lately when deaf community members come to me with questions, they may ask about the services that are provided. I get a lot of questions about the needs from the deaf community. And it sounds like that ACDHH is not at the forefront of a lot of community members' minds. And I've been thinking about that lately, you know, because hearing people often refer individuals to the commission, but deaf individuals aren't the ones making those referrals.
Really?
If for some reason ACDHH is not in the mind of the deaf community. And that's where I'm trying to figure out how we can engage them and get the word out. This is Commissioner Jantz. I appreciate your comments. And the commission has been getting the word out about their services through vlogs and through other means online. With this 5-year strategic plan, I think it's a wonderful opportunity for the board members and the commissioners and the commission, excuse me, to individually get the word out to community members saying that you have the opportunity to have your voices heard, to be a part of this process and to join us for the forums in order to provide feedback for the 5-year strategic plan. If people were more familiar with the board and the process and the commission itself and the duties of the commission and the services that are available, then people would be more likely to use the services. So not just Commissioner Keast, I ask all of you board members and the individuals who are members of communities, if you're a member of the deaf community, the hard of hearing community, and also the deaf blind community, please get the word out that we're having the forum to go over what will be on the 5-year plan. I think this is a great opportunity for community members to learn what ACDHH does and also to see what the strategic plan may look like for the next 5 years. It's a wonderful time to have community members have their voices be heard, to be a part of the process. So I think this is a great time to start getting the word out. I ask that of all commissioners. And whether it be Sherry or Betty, do you have any additional comments that you'd like to make on that topic? Oh, Betty, you're muted.
This one I should be practicing my signing. I think that's a really valid statement, Commissioner Keast. I think that's what we're identifying is that the community knows about us when they need us. But our goal is to get the community to know us before they need us. And so we've been working on that through our communication strategy plan and taking these steps that we have kind of shifted over the last year and a half. I'm sure it's been happening before I even started, but really that vision of finding different ways to engage the community before they need the services. So I think to echo what Commissioner Jant said, as well, is that this is that time, finding out from the community, showing up to those community forums, like what are they needing? How come they didn't hear about us? Where can we improve so we can get in front of this, so all community members know, whether that's the deaf, the hard of hearing, or the deaf blind community members know that we are here as a resource, and taking the actions that we've taken. We're slowly getting to that place.
This is Commissioner Jantz. Thank you, Betty and Sherry. Any additional comments? I see Commissioner Webster with the final comment, and then we will move on to the next agenda item.
I do very quickly. Without my cochlear implant, I am deaf, but my best advertising is when someone can see it. And then that gives me the chance to talk about the commission. Or what we do.
That's a wonderful comment and such a great point, truly.
It is.
Maybe we should consider the some type of logo that could go on top of the receiver that people have, just like, walking billboards. Why not? Maybe we could charge ACDHH for advertising on our devices. All right. I would like to move on to the next agenda item. This will be agenda item number 7. There are 2 interpreter complaints. I will turn the time over to Emmett, who will provide us with a summary of those complaints. We will do one summary of a complaint and then move on to the discussion before we do the next summary of the next complaint, followed by discussion about that complaint. Emmett? Hello, good evening, commissioners. Thank you so much for being here this evening. I sent you the summaries and all of the information. I trust that you have read through the complaints and the information that I sent out. These are actually inquiries that you've received as well. And I will start with Kaborski Ledbetter. And this is a pretty common situation that interpreters are in. Let me pull up that summary. For the interpreter, I'm on page 3. And this is the summary of the inquiry. Ms. Ledbetter disclosed on her initial application stating that she has worked 1 day without a license after her license lapsed January 16th, 2021. That is the summary of the complaint.
Great, thank you so much. Those of you on the board, we're going to go ahead and open it for discussion now. I think it's best that if we have any action item and that is specific that we need to talk to the AG, we want to know if the AG is connected and available for us right now.
This is Emmett. Yes, I believe the AG is connected, and I do have one more comment before we proceed.
Emmett, before you move forward, can we verify if our AG is on the line?
Yes, hello. My name is Joanne Handy and I'm present. Thank you.
Nice to hear you, Joanne. Thank you for being here on the line. Just a reminder to all of you, if you feel that you need to have a discussion or some type of consultation with the AG, we would have to go into executive session for that. If we have no questions specifically for the AG directly, then it would be discussed here in the open. Okay, go ahead.
This is Emmett. We just added a letter that we received from the applicant, and so I hope you had the opportunity to also read through that letter that was submitted to the board.
Commissioner Keast, if you could just hold on for just one moment. Thank you, Emmett, for clarifying that. The letter that was received and attached, if you need time to review that letter, please let us know. We have one head nod here. Okay, so let me give you 2-3 minutes to go ahead and read through that letter then. Emmett?
If you're not able to access that letter, I'm also happy to read that email for you.
This is Missy. I would prefer that, please. Emmett, if you don't mind, can you please sign that? And then interpreters, do you have access to that letter as well? Okay, Emmett, we're ready when you are. You guys
All right.
read, or I'll sign it. It's also going to be spoken.
Hello, Emmett. My reply is listed below. This was not an act of disrespect. It was a 10-minute VRI job for my company. And after I realized I was non-compliant, I started the process of reinstating my license, which lapsed while I thought I would no longer need it. I have always maintained my national certification without gaps as added assurance to my commitment to excellent services for the deaf. I still need to be compliant with your state to keep the one source of income I have to support my family. Please weigh this carefully. I'm a hardworking interpreter and avid supporter of the deaf community. I was being transparent to respect the system you have in place. Thank you.
Thank you, Emmett. Any additional information before we open this up for discussion? Okay, seeing none, I have a question of Emmett for a point of clarification. The applicant applied for a new license, meaning she has not been granted her license yet. Is that correct?
This is Emmett. To answer your question, Commissioner Jant, in the notes, you can see that a license was issued on January 16th, 2020. However, it expired January 16th, 2021 because the applicant did not renew. So they did just reapply for a license in March, and we have reviewed the license, and all the items and documents seem to be there for the interpreter committee that will be meeting on June 16th to review and approve licenses for consideration by the executive director.
I see Commissioner Hensley.
In that letter, she didn't think that she would need to renew her license, and that's why she didn't renew it. So I'm assuming that's why that didn't happen until March.
This is Miss
So
Ann wondering the same thing. Go ahead, Emmett.
to answer your question, Commissioner Hensley, I was curious about that as well. I didn't follow up onto the reason as to why. We've seen that happen in the past. Interpreters think they won't need their license, and then they go to work for another company where they find out they do in fact need a license, and then they have to reapply. We do see that happen occasionally.
Okay, I'm going to clarify. It seems that this individual had been working through VRI. Is that understood?
This is Emmett. Yes.
Commissioner Keast?
Do we know which company this interpreter was working for? This is Emmett. That's a good question. Let me check. They were working for Sorensen.
Sorensen, okay. And really, to me, I don't know that it matters which company it is. It's either they are working VRI with an assignment in state or not. They all have to be licensed under the state of Arizona, regardless. I think that's what really applies here. Commissioner Benton, go ahead.
So in our, we have a fee structure that was established in 2019. And in that fee structure, the type of complaint working without a license for the first 30 days, that it would be $100. So I'm wondering why staff are recommending a reduced fine.
This is Emmett. To answer your question, the board did create that proposed fee structure. Anytime an interpreter works past their expiration date, as long as they renew their license within those first 30 days, that $100 fee covers that area, that time when they weren't licensed. In this situation, the interpreter did not renew. They reapplied and disclosed that they did work one day after expiration. And so we're just focusing on that one day. And so there is a different path that we would take than we would if it had been 30 days.
Commissioner Benton. Commissioner Keast, hold on just a second. Commissioner Benton, go ahead.
Okay, then with that understanding, then I would make a motion that we move to apply a fine of $50 for this individual, because when you're working for VRI, VRS, when you're working in other states, you need to respect the licensure laws of those states that you work in. And so this individual, if they're taking calls or they might have a call from Arizona, they know they need to be licensed. So I would make a motion that we apply a fee of a charge of $50 for this individual.
Thank you, Commissioner Benton. We have a motion on the table. Do we have a second?
Commissioner Cienko, I second that.
All right, I see Commissioner Cienko. Do we have any more discussion? Commissioner Keast, I saw that you had a comment.
Yeah, as we're talking about VRI and VRS, can I get some clarification on that?
Commissioner Keast, if you don't mind, I'm going to have Emmett answer that specifically with VRI and VRS.
I'll try my best to keep it simple. Video Relay Service, or VRS, we only have jurisdiction over employees who are physically located within Arizona. For video remote interpreting, we don't have any jurisdiction over for VRS, we don't have any jurisdiction over interpreters who are out of state because that program is regulated by the FCC. However, when it comes to video remote interpreting, interpreters who are providing their services to Arizona residents, whether that interpreter is physically in Arizona or not, must be licensed. Does that clarify?
Got it. Can I add more to that? This is Commissioner Grants. Do we have you have any other follow-up questions?
This is Commissioner Keast. My concern is that a lot of those VRS and VRI companies don't realize that a lot of interpreters find themselves in informal situations where they're one-on-one with someone, and a video remote interpreting hospital may use an interpreter who is working in a medical situation. And we've seen that VRI is being used more and more frequently by medical facilities, hospitals, and doctors' offices. If an interpreter lets their license lapse and then they go and work for one of those VRI companies, that's where I get concerned that we may find ourselves having more lawsuits in the long run because an interpreter isn't doing their work that they should be doing through VRI. And it just really complicates things. And my question is a candidate and their attitude, really. You know, when I'm working with someone, there's going to be a big difference between an interpreter working in VRI and an interpreter working in VRS. And that's my concern.
Thank you, Commissioner Keast. Just as a reminder, we do have a motion and a second on the floor. That includes a $50 fine for the 1 day. As a board, we can't assume their intentions or their motivations with this specific situation. We just do know the facts that have been presented to us, and that this individual was needing a license for VRI as an out-of-state individual. So they asked to have their renewal in March, and throughout that process had disclosed that there was 1 day of work that had happened without the license. So again, Commissioner Benton has a motion that says specifically there will be a $50 fine applied to this applicant for working 1 day without a license. And there was a second on the floor. Do we have any other discussion related to Commissioner Benton's motion? Commissioner Webster?
One quick question, because I'm not familiar with some of these services. In essence, does this person's job require them to have signing capabilities? Does that make sense?
This is Commissioner Jantz. I'll turn that question over to Emmett. And this is Emmett. Yes, any interpreter who is providing video remote interpreting services, whether they're physically located in the state, if they're providing interpreting services to Arizona residents, have to be licensed.
Okay, thank you. So it wasn't a surprise that they might need to sign. Thank you.
This always applies to people that are providing services to residents. So if they have a job assignment and it's for someone that is in Arizona, even if they are outside of the state and they are accepting that job, they have to adhere to the Arizona laws. And so that's where this situation has come up.
I understand better now. Thank you.
I'm not seeing any more questions or comments. I do have one little point that I'd like to add for Commissioner Benton. If you're open for a potential amendment to your motion, I would like to add and make an amendment of to refer back to the staff to do an inquiry once the license has been approved to see if there has been any additional work since.
This
Are
is
you
Commissioner
okay with
Keist. I
that?
second that.
We have that.
I would accept that amendment.
Okay, great. We have a motion with an amendment and a second that has taken place with a fee and plus for this individual to refer back to the commission to do an added check-in or inquiry just to verify that the individual doesn't have any additional days working without a license. Jennifer, do you have a question?
This is Commissioner Hensley. I don't know if it's possible to get that information other than learning that directly from the applicant. And they already made the statement that they worked for 10 minutes that one day. But we can definitely ask again.
And that's the reason why I requested the amendment, just to refer back to the commission for them to do an inquiry after the fact. Any more additional discussion? Commissioner Keist?
I would like to add to the amendment potentially to have staff meet with the individual virtually to ask more questions, because Commissioner Hensley made a good point. They mentioned that they worked one day, but how do we know for sure? So we want to be able to talk to the applicant and to see where this could potentially lead.
I'm going to clarify that the amendment is related to the commission to do an inquiry or an investigation for Emmett. That's his responsibility as the licensure laws required for them to do specific types of investigation.
Okay, sounds good.
Okay, perfect. All right. Any additional questions or comments? I'm not seeing any, so we're going to take a vote, and I would like to go ahead and do a roll call for this, please. As a reminder, it is a $50 fee for working one day without a license, plus the amendment to refer back to the commission for additional inquiry or investigation to see if this individual continues to work any other days without having a license. All in favor, please raise your hand, or we can do a roll call if you prefer.
Roll call.
This is Commissioner Cienko. I'd prefer to do a roll call.
Okay, Commissioner Cienko wants to do a roll call, and let's go ahead and do that. If we could go ahead and have a roll call done, please.
Okay. Commissioner Jantz? Commissioner Benton?
Aye. Aye.
Commissioner Hensley? Commissioner O'Rourke?
Aye. Aye.
Commissioner Keist?
Aye.
Commissioner Williams?
Aye.
Commissioner Cinco?
Aye.
And Commissioner Webster?
Aye.
Perfect. Motion carries. Thank you, Kyla. Sorry if the interpreter is pronouncing your name wrong. Okay, let's go ahead and move on to the next complaint.
Okay, Commissioner Jantz. This next inquiry is for Sydney Rainey. I will give you the summary. And again, I assume that you've read through all these documents. She did also submit a letter to the board. The summary of the inquiry is, Ms. Rainey renewed her license and did not meet the required criteria to renew. The rationale is failing to meet at least 8 hours monthly and not teaming with either Arizona generalist or legal licensed interpreters.
Commissioner Keast, if you don't mind holding just 1 second. Emmett, if you can go ahead and explain your recommendation.
My recommendation is to take additional continuing education training on ethical decision-making and some additional continuing education training on top of the required 12 hours of continuing education for the 2021-2022 license year with at least one workshop on ethical decision-making. That is my recommendation only. You do not have to move forward with my recommendation. I just wanted to point that out.
Great, thank you. Emmett. We also
You stole my thunder, Emmett, there.
we also have a letter from this individual. Would we like to see that signed in ASL or?
This is Commissioner Keast. No, but I do have a question.
Okay, so we don't have any requests for that. Then let's go ahead and open it up for discussion. Reminder, we do still have our AG on the line. She is available. If we need to discuss anything with her, we will have to make a motion to go into executive session for that. Okay, Commissioner Keast has a question. Go ahead.
Emmett, can you give us a little bit more information about what you mean by the applicant not meeting the requirements? This is Emmett. Yes, good question. Now for provisional licensed interpreters, this is for interpreters who have a provisional B license. They have to choose either a mentoring option or a teaming option. This person chose the teaming option, which means that on a monthly basis, the applicant would have to work with an individual who was licensed for at least 8 hours per month. They would have to work as a team and document their teamwork. Based on the information given to us, she did not meet the hours required due to COVID. The law also requires that the applicant team with someone who is an Arizona licensed interpreter. However, they were teaming with interpreters in California who are not licensed in Arizona. So those are the two reasons that the individual did not meet the requirements.
Yeah, that's a big red flag for me. Okay, thank you, Emmett. Any additional questions or discussion? I see Commissioner Hensley, go ahead.
In general, did the other provisional B licensed interpreters experience a similar issue? This is Emmett. This is the first that I've heard of this specific situation. However, we have had situations in the past where if, let's say, there's been a month where in the old rules, it said an average per month, and so it averaged out. However, with the current rules, it says at least 8 hours per month. So if it's over that amount, we do accept that, but in this situation, they're under the threshold. And to give you the specifics, so during the 12-month period at 8 hours per month, that would be 96 hours. However, they only met 69 hours. They were 27 hours short. So they were below that threshold.
Okay, I do have a follow-up question for Commissioner Hensley, and then it looks like Commissioner Williams, and then Commissioner Webster. Go ahead, Commissioner Hensley.
So during the pandemic, there have not been any concerns brought up about interpreters not being able to meet those teaming required hours. No one's brought that up during the pandemic. This is Emmett. We've not had a specific candidate approach us about this, no.
Commissioner Williams?
I just wanted to, excuse me, clarify something here. In the letter from the applicant back to the commission, she stated in several instances where she misunderstood or did not have some information that would clarify her situation. And for the record, any interpreter candidates or for renewal or initial licensure should contact the commission, perhaps specifically the interpreter assessment coordinator, so that in the future, if somebody comes up with a situation like this, rather than take a guess, they would go right to the commission and clarify it. I think I'm being a little nitpicky, but this might help prevent some of this in the future.
Thank you, Commissioner Williams. Emmett, do you have a response?
Yes, thank you so much, Commissioner Williams, for pointing that out. In my notes, you will see that the applicants do sign documents saying that they will meet certain requirements. Staff has noticed historically, and even so more recently, that provisional interpreters are not understanding the rules of licensure. As a result of that, we will be providing a workshop next week to provisional interpreters to answer any questions that they may have to mitigate those misunderstandings and the problems that we've been seeing lately. And our goal is to reduce those frustrations for those interpreters.
That's very good. Thank you, Emmett.
Thank you, Commissioner Williams and Emmett both. This is Commissioner Jantz speaking. Commissioner Webster, and then Commissioner Cienko.
Commissioner Hensley asked the same question that I had, so I have my answer.
Okay, Commissioner Cienko.
My comment is for Emmett. I think that workshop is a wonderful idea. And this is Emmett. Thank you.
Commissioner Benton.
I just in pondering the information that's provided, perhaps the number of hours that the individual was able to team may be justified because of COVID, because there was a reduced opportunity for work. But I don't think it excuses the other part of it where they didn't follow the regulation regarding using Arizona licensed interpreters. So I would support a motion to have the individual do 3 additional hours of continuing education units, focusing on the area of code of professional conduct.
This is Commissioner Jantz. We have a motion on the floor. Do we have a second?
This is Commissioner Keast. I noticed that Emmett wanted to make a comment. Go ahead.
This is Emmett. Just a point of clarification.
Second.
I'm sorry. This is Sherry.
I'm sorry. I didn't have my voice. PV, if you don't mind, name who second the motion for the minute. You said several, but I missed who.
Sure. So we had Commissioner Webster and Commissioner Keast. Everybody's seconding at the same time. I think Commissioner Webster was who I saw first as a second to that motion. Okay, Emmett has some clarification. Go ahead.
Yeah, for Commissioner Benton, you said 3 hours on top of the 12 hours for a total of 15 hours? Okay.
Okay, we have Commissioner Keese that would like to make another comment.
I've been thinking with COVID, there have been less teaming opportunities, you know, and it sounds like with Zoom, there have been a lot of opportunities for workshops, and there have been free workshops available to interpreters around the state and around the country. So if someone is not able to meet those hours, I have a concern there. And I don't take legal interpreting lightly. I don't, because interpreting legal situations is very serious. The legal system is not an easy system to navigate. So 15 hours, just out of curiosity, why did we come up with that number, 15 hours? This is Emmett. For a point of clarification, provisional interpreters have to complete 12 hours of continuing education on an annual basis, and it was my recommendation to add any hours on top of that if you wanted to. Now, Commissioner Benton, were those 3 hours on specifically on ethical decision making? I wanted to make sure we got that clarification as well.
Yes. Yes, it was.
And Missy, to answer your question about less interpreting and less interpreting assignments available, we have heard from community members that there have been less interpreting opportunities for interpreters. And so you may take that into consideration as well. That's why I suggested the additional hours of ethical decision-making continuing education.
Okay, go ahead, Commissioner Keist.
And maybe I wasn't clear. During COVID, there are so many opportunities that are new to us through Zoom and through these virtual options. And so my experience, at least in COVID, has been that there have been a lot more opportunities lately. And I'm finding workshops online that are provided across the country. It's easier to get registered and to attend these kinds of events now than it was pre-COVID. Now, this individual is missing 27 hours. Is that correct?
She's short 27 hours, yes.
Okay, so I feel that the individual should meet those additional 27 hours plus an additional 15. And I'm bad at math. If someone could help me figure that out, what that would be.
Okay, this is Commissioner Jantz. Let's hold on. And I want to remind all of you that we do already have a motion and a second specifically to this individual meeting the 12 hours plus an additional 3 hours specifically related to the Code of Professional Conduct or ethics. So Commissioner Keist, if you would like, you can ask Commissioner Benton if she can make an amendment, if she's willing to adopt an amendment. That is an option for you. I think Commissioner Benton wants to clarify, and then we'll give Emmett a chance to respond.
I just wanted to address Commissioner Keist. The person was short the number of hours that they were involved in team interpreting work, not the number of continuing education workshops that they attended. So,
Right.
to me, that's a separate issue. They didn't get enough hands-up time, enough work time to meet the hours that they were supposed to get as a provisional interpreter, but they have to still do their 12 hours. So that's why I thought the additional 3 hours of, yes, all those workshops that are available, and many at no cost now, but certainly to have workshops that are in the area of ethical decision-making would be appropriate.
Thank you, Commissioner Benton. Emmett? You read my mind. You said it all. Thank you.
This is Commissioner Jantz. Okay, so let's just do a point of clarification and check in again. We have a motion of doing the 12 standard hours of training plus an additional 3 hours of continuing education to be able to meet the licensure requirements of 2020 before 2022. Is that correct, Commissioner Benton? Okay, great. So that motion has already had a second. I have a feeling that we should do a call for a vote now, and let's do that by roll call. Kyla, if we can have you pop back in and take a vote, please.
Commissioner Jantz? Commissioner Hensley? Commissioner
Aye.
Benton?
Aye.
Commissioner O'Rourke?
Aye.
Commissioner Keast?
Opposed?
Commissioner Williams?
Aye.
Commissioner Cinco?
Aye.
And Commissioner Webster?
Aye.
Okay, motion carries. Thank you. I appreciate it. Thank you, Kyla, for doing the roll call. Next on the agenda is number 8.
The Interpreter Licensure Committee update.
So are we ready to go ahead and give your update? This is Commissioner Jantz, excuse me. I actually forgot one thing. Please, Joanne, thank you so much for being here with us. We appreciate your time. We're gonna go ahead and let you go. We're all done with you for tonight. Thank you.
Thank you very much, Commissioner.
Thank you.
Bye-bye.
Okay, now let's turn it over to the Licensure Committee update.
Thank you, Commissioner Jantz. The Licensure Committee met in February and April. In total, we reviewed and approved 43 applications, and just always find it interesting how many were in-state and out-of-state. 37 of those were out-of-state applications. So again, just like what we were talking about earlier, when we have VRI, VRS interpreters working in other states, it's their responsibility to have an Arizona license in order to take calls or to take any interpreting jobs that occur in the state of Arizona. And when we review the materials, one of the questions is, have you ever been licensed in another state? And very often we see interpreter applications where they include a whole host of licenses that they hold in other states, because we're not the only state that requires a license. So if I were a VRI, a VRS interpreter, it would be incumbent upon me to then have multiple licenses so that I would be licensed in every state that I accepted work. So that's our professional responsibility. So yes, out of the 43 that we approved, 37 of those were out of state, primarily VRI, VRS. And I also just wanted to give a good shout out to Emmett and Victoria for the great interpreter appreciation video that you guys did, and the interview that you did with Dustin and Amy. And it was a great, great tribute, was wonderful, great, very well done. And thanks for doing that. And thanks for recognizing the work of interpreters. And that's all I have. Thank you.
You're muted, Chelsea. Thank you so much. Yeah, that was wonderful to see that video. And
I really appreciate the shout out to the interpreters. I think that it was absolutely wonderful and a little bit ironic, and maybe a little just kind of a reminder to all of you to verify that we have a famous interpreter with us this evening, you can ask him for his autograph before he leaves.
Dustin is in the house. Mhm.
This is Commissioner Stanko. I think I can see Dustin blushing.
Yes, great work making that video. It's wonderful. One thing that I really wanted to see more of is in-state applications. I just really crave that. And it's, I think, you know, challenging. One thing that I've really considered is how to try and recruit more licensed applications, right? Licensing applications and more individuals that are wanting to do this. So maybe that's something that the licensing committee can discuss and try and look at how we can grow that pool. Any other questions related to the licensing committee? Emmett?
I just wanted to make a quick comment. We have several interpreter preparation program graduations happening this month. I think that we have 22 from the University of Arizona, and we have several from Phoenix College. So we're hoping to see more applicants here pretty soon.
Great, that makes me so happy. That'll be a good number of interpreters coming soon. So Emmett, I hope that you are on them.
I'm trying.
The commission's watching you. Get your application in or else.
Will do.
Don't scare them away yet. Okay, so let's go ahead and move on to number 9. Yeah, number 9, point of discussion for our future board meetings. With the recommendations kind of lessening as the protocol is concerned, I just wanted to open it up for discussions to the boards to see what our next board meetings are going to look like. In person, are we going to do it remotely? We had also considered Sherry Collins, you know, just if you wouldn't mind, before we kind of get into an in-depth discussion, talk about the technology and the limitations and what this looks like from both angles.
Thank you, Commissioner PB Jant. The reason for putting this on the agenda because of the pandemic is now becoming more flexible since more and more people are getting the vaccine and the numbers are decreasing. I just wanted to have the board and make a decision about continuing doing your board meeting through Zoom or in person like we have in the past. The challenge is to do a hybrid, for example, Zoom plus in person would be challenging because of all the different communication. So it'll be like if we meet in person, for those who can't be here in person, we'll call in like we have, you know, in the past, not on Zoom, but call in. That's how we've been doing it all along. So I just, you know, those are the challenges, but I just need for you to let me know how you want to do your, you know, to the board meetings, the staff, our agency will continue the hybrid work environment. So I'll just leave that for you for just.
Okay, thank you so much, Sherry. I appreciate you commenting on that. So now I'm going to turn it over to the board for you guys to have a discussion on whether or not you'd like to see these continue remotely or go back to in-person. Just your thoughts on this. I see Commissioner Keast first. Why don't you go ahead?
Yes, thank you. I've been in karate for quite some time. I want to put out a little bragging rights here. Got my black belt just passed 3 weeks ago. So excited to finally have that. But during COVID, for the past 1 year, when we didn't have a vaccine, I was meeting with the same group to practice for our upcoming tests. And things seemed to go okay. You know, thank God no one was sick. Everyone was fine while we were meeting. But we did also have some Zoom karate classes from the dojo. And so they have the karate gym that you can take classes at. They had some people there in person, and then they did the hybrid model. But I noticed that the people who were on Zoom were pretty much left out big time, really. Once the people who were all there in person kind of got going, we realized that it was better to be in person. You know, we're human people, we're social beings, whereas on Zoom, we were just kind of left out. And that's something that I have noticed when a hybrid approach is taken. So I'm a big supporter of meeting in person if everyone is okay with that. I may be a little too optimistic here, though.
Thank you, Commissioner Keast. Do we have any other board members that would like to make a comment? Commissioner Hensley?
This is Commissioner Hensley. I think either completely in person or completely on Zoom. I think taking that hybrid approach, it generally does not work out. Someone is going to miss something somewhere along the way. Someone is not going to have access, and someone is going to be left out and won't have information. So I think either in person or on Zoom.
Commissioner Hensley, thank you. Do you have a specific preference you'd like to mention?
Commissioner Hensley. I think until we're all ready to meet in person, we should continue to meet through Zoom.
This is Commissioner Keast. I agree. I see another comment from Commissioner Cienko. I'm trying to think back in the past to where we were a year ago. A lot has changed in a year. It's made an impact on everybody, and our viewpoints have changed. Everything really has changed. It's affected so many things. Sorry, I was distracted there for a minute. As much as I love being in the same room with each and every one of you, I do think that there are still cases and the numbers fluctuate from day to day. So I definitely agree with Commissioner Hensley. It's just to use Zoom until we get the green light. I know it's 2D here. You know, it's a two-dimensional space, but I do think that that would be my suggestion. Thank you, Commissioner Cienko. And just a reminder, this is a discussion for you. You do have the opportunity to vote and decide if you want to continue meeting through Zoom and for how long, or in person. Then that would just be open for you guys to discuss and agree upon, or we can make a decision. I see Commissioner Keast.
I agree with Jennifer Hensley and Commissioner Cienko. I think it's best to wait. I don't think that we have the right information right now to make that kind of decision. And if we meet quarterly and we can see how cases have been moving, and we can then at that time make a decision whether we should meet in person or on Zoom. But I agree that we should not use both approaches. We should, I think, continue with Zoom until we kind of have that green light.
Okay, thank you, Commissioner Keast. Just to clarify, we as the board decide. We're the ones to say it's a green light, we're going to do this or not. So we're the ones that can make the decision. So
That's what I mean. If we meet quarterly.
I think Sherry has a comment, and then we'll turn it over to Commissioner O'Rourke. Sherry?
The reason, and you're right, all of the comments that were made, continue with Zoom, but I did not want to make that decision because a lot has changed recently. I wanted to make sure that the board feels the same way. It's not my position to make that decision with the board. That's why we're continuing the hybrid, because we're not ready to go back in the office. But, the board can do what you believe, and I have to, support the board. So I want that discussion for you to tell me you want to continue, because we are not 100% out of the woods.
Commissioner O'Rourke? You're on mute.
I thought I was on mute and I couldn't find my mouse fast enough. So I would just like to say that as a new commissioner, and so far having only attended meetings on Zoom, I actually find them very helpful and concise. I know a number of the members already, and at the second meeting, I have gotten to put names with faces with more. I feel that because this is a business meeting, that's the way I see it. This is more so than a social meeting, that continuing on Zoom would be taking advantage of the technology that is there for us to use now. So I guess what I'm saying is that I would like us to consider, not only as we follow the guidelines, but perhaps into the future, perhaps consider having a meeting on Zoom with that in mind, because it's more of a business meeting than a social gathering.
Thank you, Commissioner O'Rourke. It almost sounds like a motion. Is that what I'm hearing from you? Commissioner O'Rourke.
No, I guess I was just sharing my feelings as, having attended these meetings, and this is the way I've attended them. As everyone else has said before, I think we need to continue with Zoom until we get a more specific guideline from CDC, but looking into the future, maybe that's when a decision would come.
Okay, great. Thank you, Commissioner O'Rourke. Also, as a reminder, we will make that decision on whether or not to continue or to go back in person as the board. So someone will need to make the decision and vote. We have Commissioner Keast with a comment.
I would like to make a motion that we have the ACDHH board meetings on Zoom for at least the next 3 board meetings. So that would take us into the fall, winter, and spring.
Okay, we have a motion on the floor. Do we have a second?
Commissioner Hensley, I second that.
Okay, I see your second, Commissioner Hensley. So then our August board meeting, our November board meeting, and our February board will all be on Zoom.
Mm-hmm.
That is the current motion on the floor. Any points of clarification or discussion on this motion? Commissioner Webster?
Last year, or I guess it was 2 years ago, I was a new commissioner. And I know meeting in person gave me more of a connection to the other commissioners as well as the staff from the Commission of Deaf and Hard of Hearing. I hate to see us wait 9 months before we meet in person again.
Thank you, Commissioner Webster. Commissioner Cienko. Two things. I agree with Commissioner Webster. 9 months does seem a little bit long. I was thinking maybe we could revisit this conversation at every board meeting. So in 3 months from now, we can reassess and discuss how we are feeling at that time. Who knows what will have changed by then. And then secondly, I was thinking about the meetings that we've had over the past year through Zoom, and I've noticed that one thing is missing, and it's public comments. And I would like to be able to say that we could include them in future meetings and how we would be able to do that. It's almost like a webinar platform, right? Where people are just viewing and that's it, without the ability to make public comment. Thank you, Commissioner Cinco. As a reminder, it is on the agenda for us to discuss this public comment, and that's why this is an action item before that. We'd like to decide how we're going to facilitate our board meetings and how we can be able to, I think that will help us to be able to better decide how on future meetings we'll be able to include the public. So right now we had a motion and a second on the floor to have Zoom meetings for our board meetings for the next 3 meetings for the next 9 months. So that would be August, November, and February board meetings via the Zoom platform. So then the next in-person meeting would be next May.
That's 9 months.
Mm-hmm.
That is potentially a long time. I'm happy to add in as well with the situation with COVID that had happened right before we planned to set up a board meeting away in Yuma to be local with that community. And I've been feeling as though they have been very left out, and I really want to honor the information that they had given about feeling left out. And it is on the agenda, but if we stick that off a whole nother year, as the commission, as the board, I don't feel that that is the right thing to do. So I want to make sure that we have a good balance with health and safety plus the community and giving them an opportunity to be involved and exposed to what it is that we do. So when we're in person, there's the potential and the ability for them to be involved and have public comment. So I think having a balance would be great. So we do have this motion on the floor to have our board meetings, the next 3 of them in Zoom. So we can continue to discuss this. We can make an amendment, or we can go ahead and vote on this motion. Commissioner Keast, do you want to make a comment?
This is Commissioner Keast. I love your idea, PV, about us going back to Yuma to host a meeting there. I think that's a wonderful idea. I've noticed that the CDC has talked about these social opportunities and social distancing and mask wearing. So I do like your idea, Commissioner Cienko, of instead of having our next 3 board meetings be virtual, we could have our next 2 board meetings be virtual, followed by a socially distanced board meeting. Would that work? in Yuma.
Okay, so to clarify, remember we already have a motion and a second on the floor. And so that motion has been detailed to say it would be the next 3 meetings. So you can either withdraw that motion, or you can make an amendment to it, or we can need to go ahead and vote on it.
I would like to amend my motion. This is Commissioner Keast. It was my original motion to have the next 3 ACDHH board meetings be virtual. I would like to change that to 2 virtual board meetings. In addition, that 3rd board meeting would be in person following CDC best practices. Can I say that?
Okay, so we have a amendment. She's made an amendment to her motion.
This is Commissioner Hensley. Can I make a friendly amendment?
Okay, this is Commissioner Jantz. Let me clarify briefly the amendment and the emotion right now. The amendment to the motion right now is that we take the 3 Zoom meetings and reduce it to 2 Zoom meetings, with the 3rd, which would be the February board meeting in Yuma, practicing CDC guidelines, whatever their requirements would be. Okay, Commissioner Hensley, did you want to make your friendly amendment?
Are we ready to talk about where that 3rd meeting would take place? Because I think that we should not go there quite yet. I would rather wait before we say anything about the specifics for that 3rd meeting. I would just say our next 2 meetings be virtual and keep it at that.
Commissioner Keast, are you willing to accept that?
Just to clarify, does that mean that I'm is this a challenge to the motion, or is this an amendment to the motion? Does it override my motion?
This is Commissioner Jantz. Just to clarify, your amendment was to have 3 board meetings all on Zoom. That was then changed to having 2 board meetings on Zoom, with a 3rd in February in Yuma following CDC guidelines. Commissioner Hensley made an amendment to that to actually redact the last portion of that and leave it be as just the next 2 board meetings on Zoom.
This is Commissioner Keast. That is perfectly fine with me.
So we have a motion to have the next 2 board meetings on Zoom, and that's it. That's the motion. Commissioner Webster, you have a comment?
I was going to point out a parliamentary procedure, but it's fine.
Oh yeah, please, if you don't mind.
I could be wrong, but technically I believe we would have to vote on the amendment first and then go back to the original motion.
This is Commissioner Hensley. It was a friendly amendment. This is Commissioner Jantz.
That's fine.
It's my understanding that if it's a friendly amendment that is accepted by the individual who made the motion, then we can move forward with it. However, if someone is not happy with that amendment,
No,
then
that's why I said that it is fine.
This is Commissioner Hensley. Thank you. This is Commissioner Jantz. If we're happy with the current amendment, we will move forward with some final comments. But keep in mind that the public comment portion is separate. That's our next agenda item. Right now, we're just talking about whether we'll be meeting in person or if we'll be meeting remotely. The current motion, as amended, is that our next 2 board meetings, meaning the August board meeting and the November board meeting, will both be done virtually. Any final thoughts or comments? Seeing none, I think we are ready for a vote. All in favor, please say aye.
Aye.
We got 4 ayes. Any opposition? If you are opposed, please keep your hand raised. Any abstentions? We have 4 for and 3 opposed. Motion carries. The next 2 board meetings will be conducted on Zoom. That'll be specifically our August and November meetings. Okay. Next agenda item is in regards to public comments. Because we will be meeting in person on Zoom for the next 2 board meetings, we will have to talk about how to move forward with public comments. And Director Collins does have some ideas. We'll turn it over to Sherry.
Thank you. And left that on the agenda in case something changes from the previous discussion. So now that you've decided the next 2 board meetings will continue on Zoom, just to let all of you know that I already have my internal staff, Kyla and Jeremy are leading, putting together to allow public comment to participate during our virtual meeting in August. We wanted some time to put the guidelines, everything on our website, including video blog messages to be clear to the community so that we're transparent. We can let the public know what is the process to participate public comment during our board meeting. We have an internal outline that is being discussed. To my recommendation, because of the timing, it really is more of a technical part, but to respond to Commissioner Eco that we intend to do that in August, but I wasn't sure if we're going to be in person or not. So now that in the next 2 meetings, we will have everything ready for August. So what I like to recommend that I will share the outline, what it would look like with the executive board member, the president, vice president, and secretary for your input before we finalize, if that's okay with everyone.
Thank you so much, Sherry. Any other comments or thoughts or response to what Sherry just mentioned? I would like to say, as a member of the board, I would like the board to be able to accept public comments at the August board meeting. I think that will give us the time to do it. Remember, this is an action item. So if we do want to have public comments at the August meeting, we want Director Collins to have the option to move forward with that if it's a possibility, but we do need a motion to indicate what options are available to Director Collins. Seeing that, oh, Sherry?
Really, it doesn't need an action item. It's my recommendation that I work with the board officer with the outline. I left that on the agenda in case you need to take action, so you really don't have to, because we're already working on it internally with the technical aspect, and I will have the board officers to review the outline before we implement that process, if that's okay by everyone.
Board members, any thoughts or comments? it seems that the general consensus is pretty positive, and it sounds like the board is okay with that suggested timeline. And the board officers will be available for that internal discussion. And I think that the board does realize that we would like to have public comments at our board meetings again as soon as possible. And because our next board meeting will be done virtually, we will get the work started on making sure that we have public comments at the next meeting. I see Commissioner Webster and then Commissioner Keast.
I have a question. The public comments come through what venue? YouTube? Who is this public that would be making comments on the Zoom meeting?
Well, the way it will work
This
is that, for example, Jeremy is behind Steam here during our meeting. He will handle, assist perhaps other staff, but I'm going to use him as an example because he tends to lead this. He will invite that person if they want to come into the Zoom meeting. They will not be sitting watching like this the whole time. We will invite them when it's time for public comment, or they could submit their comments prior to the board meeting.
Prior to the board meeting. Oh, okay. So it would be like the people that attend and we know in advance when we're in person.
Yes.
Thank you very much.
Commissioner Keast. We know that we will have some community members who may watch the meeting, and within the Zoom capabilities here, you'll see that you can click the reactions button and to raise your hand. So as long as we have someone who's keeping an eye on that, it should work out just fine. This is Commissioner Jantz. Would like to clarify that the public comments would need to be submitted beforehand because there would be no opportunity to take live public comments. So all of the submissions would have to come in prior to the board meeting starting. And unfortunately, we don't have the tech ability to allow the public into the Zoom room to provide us with public comments. And that is one of the unfortunate parts about using Zoom to meet virtually, is that we don't have the opportunity to accept live comments while we're meeting remotely. And so in the interim, we would ask that people submit those comments before we start the board meeting. Commissioner Keast, do you have a question?
Yeah, I was just recently in a business meeting of over 300 people, and they had one person that was the moderator, specifically assigned as a very neutral party to be able to spotlight individuals and really manage the flow of the meeting. And that was during a question and answer as things popped up live for over 300 people. And it was incredibly fluid. And I was really quite amazed at how efficient that meeting was. So is that something that I can propose, or is there a reason behind not being able to do that?
I'll make a quick comment and then I'll have Sherry address that as well. When it comes to technology, the number one thing that we need to make sure that we're mindful of is, we're able to control the meetings. There's no Zoom bombs happening, there's a security concern. We want to make sure that we keep our meetings secure. And secondly, as we live stream our meetings, there can be a bit of a delay between what people see online versus what we're talking about in the Zoom room. And so there is a bit of a delay that could cause some potential confusion or misunderstandings or even miscommunication. If we did have individuals give live public comments, we would have to make sure that that opportunity was accessible. So when people are providing public comments, they would be able to do it in an accessible manner. we need to be able to meet all the needs of individuals who may be making a public comment. In the interim, we decided to just log the comments and have them submitted beforehand. Sherry, did you want to add something?
Yeah, if you remember, our meeting is very formal and the process that we follow. So just remember how we handle public comments during board meeting. The blue card has to apply the same thing for the public. They have to fill out that blue card because we have to know what topic related to the agenda or not agenda item. And that goes back to control of the meeting for the chair. So the public has to fill that card in advance anyway. We just can't allow them to show up and speak without completing that card.
Thank you, Sherry. And that relates back to the technological capabilities, and we're just not quite there yet. So we need to make sure that we are doing what we can in the meantime, but the compromise at this point, it sounds like, would be to accept public comments, but individuals can review the agenda up to 48 hours before a meeting, and they can submit the public comment on agenda items as well. And we'll have the deadline in place by when comments must be submitted before we start a meeting. That way the chair and the secretary, commission members and staff are able to compile all of that and get that information out to the board members and make sure that it's placed at the appropriate time within the meeting. We also need to make sure that that process is accessible for everyone as well. And I think we pretty much covered everything on that agenda item. It sounds like everyone is happy with the proposal from Director Collins about working with the board chair on a timeline to talk about what that may look like, the technology involved, and potentially have that ready for our virtual meeting in August. I'd like to move on to agenda item number 10. That is future agenda items. Is there anything that you would like to see on a future agenda? I see Commissioner Hensley.
I'd like to see a topic addressing young deaf individuals and young deaf adults. What is the commission doing to address that population?
Agenda items. Is there anything that you would like to see? Is there a specific title that we would put or a specific area for the agenda, or is it kind of just everything for that entire population?
I mean, yeah, that specific population, because sometimes it's a little bit of a challenge, you know, to get them included, and that's just all over the U.S., right? It's a challenge for work. It's a challenge for colleges. It's a challenge, you know, what's happening with them after they graduate. We in ASDB here in Arizona, we do try and reach out to them and to our students for a period of time, but then as that fades out, what happens to them, right?
This is Commissioner Jantz. Thank you so much. We'll put that general topic on the agenda, and then we can work together to narrow down that topic or maybe come up with some specific agenda items that we could go over at the next board meeting. Any other agenda items? Commissioner Keast?
This is a little bit hard to articulate. I'm not sure if this is, you know, let me just say that there's a lot of deaf people that have contacted
A lot of deaf people have contacted me about finding a job, and I've had people reach out to me, and I just tell them, go to Home Depot, because Home Depot is hiring. Places like that are always hiring, and people are unsure of what to do or how to proceed when it comes to that kind of thing. And perhaps training is needed to train the community on how to fill out job applications and how to interview. This is just something that I've been seeing lately as a trend.
Do you want to title that under a specific topic and what you'd like to discuss? Maybe job availability for the deaf, hard of hearing and deafblind community. We can encapsulate it under that.
Yeah, slash a training on how to take the initiative when it comes to applying for a job and interviewing.
Remember, keep in mind, we as the board have to address specifically what we can do as a board in our involvement.
Well, perhaps there's a grant where grant monies can be procured to provide a training.
Just one second. So I want to just make sure that we have a clear topic for the agenda. So if you need additional time, we can have an outside conversation before we put something down.
I think that'd be best. Sounds good.
I see Commissioner Cienko and then Betty.
This is Commissioner Cienko. I don't have anything. Betty?
I just wanted to, real quick for Commissioner Keys, we can definitely talk offline because it sounds like what you're talking about is our Let's Get to Work campaign, which is about hiring from the community, and we have different areas of focus and provide trainings. So we can definitely talk further about that.
I've seen information about that. Okay, sounds good. Wonderful. Looking forward to our discussion.
Commissioner Keys, that'll be a great time for you to kind of go through that and see if you want to put that down on the agenda for a future board meeting. You can let me know. One thing that I wanted to let you know is we have already voted that the next 2 board meetings will be on Zoom, and it is on the agenda and discussion for after that to decide where and what how we will be meeting. And so we'll be evaluating that as we go. And so I'll be sure to put that on the agenda as well. Any other topics you'd like me to put down? Seeing none, I will entertain a motion to end our meeting.
This is Commissioner Cienko. I move that we adjourn. It's Commissioner Benton. I second that.
We have a motion by Commissioner Cienko and a second from Commissioner Benton. All in favor, please raise your hand. Any opposed? I see none. I would like to say thank you so much to the interpreters and to our captioner this evening, to the commission and all the staff, and all the IT support. Jeremy, I see you working behind the scenes over there. Thank you for making this meeting happen. Thank you all so much.
Don't forget Emmett.
Night. And it is 7:17.